Hello, this is John. This is my patient assessment for the first half of this. I have my patient here. You can't see her. This is Brittany. We will see what we can do here. Okay, go ahead.
You arrive on the scene where a 57-year-old man is complaining of chest pain. He is pale and sweaty.
Okay. As I arrive on scene, I have PP on. Is my scene safe?
Yes.
My NOI seems to be chest pain. Is there just one patient?
There is just one patient.
At this point, I will not consider dispatch, and the patient seems to be okay. Did you fall at all?
No, I haven't.
Okay. I will not consider C-spine. As I approach the patient, I want to ask how they're doing. Hello, my name is John. I'm EMT. Can you tell me your name?
Hi, my name is Brittany Tierney.
Okay. Do you know why we were called here today?
Yes, my chest really hurts. I have angina, but this pain is worse than any I have ever felt.
Okay. So my patient seems to be conscious, aware. So level of consciousness is good. General impression is going to be chest pain and with previous history of angina. At this point, I will start my ABCs. So I have my airway. Is my airway patent?
It is.
I'm going to check the breathing. Check. Do I hear anything? Because I am checking
Normal lung sounds.
normal lung sounds.
Mm-hmm.
And then I'll do my respiratory rate. And then what is that?
24 in shallow.
24 in shallow. Okay. And then I'll get my pulse. Okay, my perceived is 22. What is my actual?
124 and weak. Skin is cool and clammy. No bleeding.
Okay. Just write some stuff down here for my findings. Okay, so, and I don't see any bleeding, major bleeding, stuff like that. Okay, so at this time, because of the chief complaint of angina and whatnot, I'm going to do a priority transport. I'm also going to give some oxygen via nasal cannula, and we are now in the EMT van. At this point, what were you doing when this started?
The pain woke me up from my afternoon nap.
Okay. Is there anything that makes the pain worse or better?
It hurts really bad, and nothing I can do makes the pain go away.
Okay. Can you describe the quality of this pain?
It started out like indigestion, but has gotten a lot worse. It feels like a big weight is pressing against my chest. It makes it hard to breathe.
Okay. And then does this pain radiate anywhere?
My shoulder and my jaw started hurting about 10 minutes before you got here, but the worst pain is in the middle. That's
Okay.
why I called you.
Okay. And is that pain consistent, or does it come on and off?
It's consistent.
Um, and on a scale of 1 to 10, how would you describe this pain?
This is the worst pain I have ever felt. I can't stand it.
Okay. So, pretty high. Okay. Okay. And what were you doing? And you just said you were sleeping when this happened?
Yeah.
Okay. Do you have any allergies?
None.
Are you on any medications?
Nitroglycerin.
Nitroglycerin? And did you take a dose of that?
I took my nitroglycerin about 15 minutes ago, but it didn't make any difference. Nitroglycerin always worked before. Am I having a heart attack?
I can't tell you right now. We have some more questions to go through before I can do that. Okay. Is there any past medical history I should be aware of?
Diagnosed with angina 2 years ago.
Okay. And you said that this is pain that's a lot worse than angina.
Mm-hmm.
Okay. What was your last meal?
I had soup and a sandwich about 3 hours ago.
Okay, and oh gosh. Yeah. So at this point, I'm just going to start my secondary assessment. I'm going to start with look, listen, feel. As I look at the chest cavity of the chest, am I seeing anything abnormal?
You are not.
What if I feel it? Is there anything normal? Any bumps? Any bumps or anything?
No.
Okay. And then as I listen, do I hear anything bad?
No.
Okay. I'm just gonna start vitals now, and start with your blood pressure.
Blood pressure is 144/92.
Okay. And we did the respiratory rate. It was 24. Our pulse was 124.
Correct.
Okay. At this point, I'm going to call medical control and ask for any other intervention as we transport the patient. As I call medical control, I will say I have a 45-year-old male with a chief complaint of chest pain with previous medical history of angina. Vital signs are 24 and shallow with pulse of 124 beats per minute and cool, clammy skin. They are currently on oxygen and nitroglycerin 15 minutes ago. And I'm going to ask if I can give a second dose of nitroglycerin, sublingual, and authorization for that. And at this point now, I'm going to reassess the patient every 5 minutes. And as I arrive at the hospital, I will then transfer care to a nurse and state again, I have a patient age 45, is male with chief complaint of chest pain, past medical history of angina, vitals 24 breaths per minute and shallow, 124 beats per minute with cool, clammy skin. Current therapy is on oxygen and nitroglycerin, and the patient states that this is the worst pain that they've felt, even comparing it to angina. And that's it.